Many Canadians do not currently have a family physician. That is not a political statement, it is a practical reality in many parts of this country. Understanding what your local pharmacist can and cannot manage helps you navigate minor health concerns efficiently, safely, and responsibly. Pharmacists are highly trained healthcare professionals. In every province and territory, their scope of practice has expanded over the past decade. While exact authority varies by jurisdiction, pharmacists across Canada can assess and treat many minor conditions, renew certain prescriptions, provide vaccinations, and offer medication management support. Knowing when to use pharmacy services, and when not to, improves continuity of care and prevents unnecessary escalation to walk-in clinics or emergency departments. This video is about understanding that scope clearly and using it wisely. While regulations vary across provinces and territories, pharmacists in many parts of Canada can assess and treat minor ailments as per the following list. Uncomplicated urinary tract infections in eligible patients. Cold sores. Mild acne. Dermatitis and minor skin rashes. Mild conjunctivitis. Hay fever and seasonal allergies. Allergic rhinitis. Insect bites. Minor fungal infections. Uncomplicated hemorrhoids. Mild heartburn. Certain types of headaches. Seasonal allergies and hay fever are among the most common conditions pharmacists manage in Canada. Symptoms such as sneezing, itchy or watery eyes, nasal congestion, sinus pressure, and mild discomfort can often be treated effectively with pharmacist-recommended or pharmacist-prescribed medications after an appropriate assessment. Pharmacists can also renew certain ongoing prescriptions within defined regulatory limits, provide vaccinations, offer smoking cessation support, conduct medication reviews, support chronic condition management in collaboration with prescribers. Pharmacies are one of the most accessible healthcare touchpoints in this country. That accessibility matters when used properly. In many provinces and territories across Canada, pharmacists have the authority to renew certain existing prescriptions for the purpose of maintaining continuity of care. This authority applies only within defined regulatory limits. Pharmacists must assess the patient, review medication history, and determine that renewing the medication is safe and appropriate. Duration limits and medication categories vary by jurisdiction. In some situations, pharmacists may contact the original prescribing physician. In others, renewal may occur independently under provincial standards. Pharmacists cannot initiate complex new therapies outside their authority, and certain controlled or monitored medications may have additional restrictions. Patients should confirm local regulations and coverage policies within their province or territory. This is not automatic renewal. It is regulated clinical judgment within defined boundaries. Pharmacists operate within a defined regulated boundary. They cannot diagnose complex medical conditions requiring imaging or advanced diagnostics. They cannot manage emergencies. They cannot replace comprehensive medical assessment for serious or systemic illness. You should seek urgent medical care if you experience any of the following: chest pain, shortness of breath, severe abdominal pain, sudden neurological symptoms such as weakness, slurred speech, or confusion, a high persistent fever, signs of severe infection, significant trauma, or any rapidly worsening health symptom. Pharmacists are trained to identify red flags. If your condition falls outside their scope, they will refer you appropriately. Understanding these boundaries protects you. Here are common real-world examples where pharmacy care is appropriate. You develop mild urinary symptoms without fever or flank pain. You experience seasonal allergy symptoms during peak pollen season. You run out of a prescribed medication while traveling. You develop a localized rash without systemic symptoms. You notice early signs of a cold sore. You experience mild heartburn that is new but not severe. In these cases, visiting a pharmacist may provide timely treatment without the need for a clinic appointment. However, if symptoms worsen, persist beyond expected timelines, or involve systemic signs such as fever, escalation is appropriate. Pharmacy care is not a shortcut. It is a defined point of access within a larger healthcare structure. Coverage varies across provinces and territories. In some jurisdictions, some minor ailment prescriptions are publicly funded. In others, private insurance or direct payment may apply. Vaccinations may be publicly covered under specific programs. Prescription renewals may or may not be covered depending on provincial policies and insurance plans. Before proceeding with assessment, confirm whether a service is covered under your provincial health plan or private insurance. Pharmacies can clarify this before treatment begins. Clarity on cost prevents misunderstanding. To make the most of a pharmacy visit, bring the following: a current list of all medications you are taking, information about allergies, your provincial or territorial health card, a clear description of your symptoms, including duration and progression. Providing accurate information allows the pharmacist to assess appropriately and determine whether the issue falls within their scope. Preparation on your part improves outcomes. Pharmacists are not replacements for comprehensive medical care. They are readily available and accessible healthcare professionals operating within defined boundaries. When used appropriately, pharmacy services can provide faster access for minor conditions, improve continuity of medication management, reduce unnecessary emergency department visits, support the overall healthcare system efficiency. Understanding the scope of the services available changes how you navigate care. Pharmacists are part of the system, not outside it. Pharmacists are one of the most accessible healthcare resources in Canada. Knowing what they can manage and what they cannot allows you to make informed decisions. Use pharmacy services appropriately. Escalate when necessary. Maintain awareness of your provincial regulations. And when in doubt, seek medical attention. This video is informational only. It is not medical, legal, or professional advice. Always verify with your local pharmacist or healthcare provider. Knowledge is empowering. And being empowered is how you move forward through Canada's ailing healthcare system with confidence. If you found this helpful, please like, subscribe, and share. It helps more Canadians access this information. Canada only. The Start Here playlist is on the channel.